You asked how to manage motion during high-dose SBRT treatments. We're answering with a compression tip that uses a thermoplastic mask for sub-millimeter precision without sacrificing comfort.
So now we're going to demonstrate an SBRT setup with a thermoplastic compression. We also put this foot support on here too, because with the SBRT setups, I like to introduce the foot support because you kind of sandwich the patient in between foot support and the cranial backstop on the head support. So there's really no ambiguity. I think we're ready for the mask. Let's go. We're going to coach you through the breathing now. So breathe in for us. Nice deep breath. Out. Breathe in again for us. Out. So Scott's going to hook his side in first there. We're always going left to right so we don't mess up the patient positioning. I'm going to go here.
All right, and again, with the oven, we do have plenty of time. There's really no need to rush. So from this point, we're gonna do 2 folds of this mask and get it right under the patient's diaphragm.
Okay, so breathe in for us, out, in.
Perfect, we'll do 1 more.
Yeah.
That's money. All right, so next thing we're gonna introduce is a wet towel.
So right now, we're kind of creating a shelf for her diaphragm. It's like supporting her diaphragm. So one more time. Out for in, out. Okay.
Now one more time, and on your exhale, we're going to apply pressure.
Got it. Now we'll try to apply some pressure here.
So now we are applying pressure with this wet towel.
Okay.
2 reasons why we use the wet towel. Number 1, it's cold and wet, which helps speed up this drying process. Since we did roll the mask over a couple times, it does take time for that thick portion to dry. So this does speed that up. The other thing is a dry towel will tend to stick to the mask a little more. So that wet mask kind of allows you to easily remove it. Yep. So Justin and I are just applying a nice constant pressure kind of down and up towards her diaphragm.
Here you can tell having the towel cold and wet.
Yeah, it's already starting
really
to dry.
helps that to cure.
So even here, we're really in a good spot. Now, the mask is not cured enough to take it off, but we're probably good to discontinue this pressure that we're
How do you
adding.
feel? Try taking a slight deep breath in. She can't really do it. Okay, that's good. Does it feel uncomfortable at all? Okay. So it's gonna stick. So the reason why we have this towel over her lap is it's gonna stick a little bit to some dry fabric.
And again, in a real patient setting,
They would have no
pants on, you know, straight mask to skin contact.
That looks great.
Yep.
Again, put them in the inner slots here. Don't forget, always start on the left. Yep, still very tight here.
And again, mask goes on pretty good. We're applying that nice constant pressure that we did with the towel. And you can see we're getting shallow breaths. Do you feel like you just can't take a deep breath? Yeah. But can you still breathe? Beautiful.